Is FEV1 FVC ratio key to diagnosing asthma versus COPD? Imagine trying to tell the difference between two similar breathing problems. One might be asthma, and the other could be chronic obstructive pulmonary disease. How do doctors tell them apart? The answer often involves a test called spirometry, which measures how well you breathe out. A key part of this test is the FEV1 to FVC ratio. But is this ratio alone enough to tell if someone has asthma or COPD? Let's find out. The FEV1 stands for forced expiratory volume in 1 second. It measures how much air you can forcefully blow out in the first second of a breath. The FVC is the total amount of air you can blow out after taking a deep breath. The ratio compares these two numbers to see how open your airways are. If the ratio is low, it suggests airflow obstruction. Both asthma and COPD can show a reduced FEV1 FVC ratio, so just looking at this number doesn't give a complete answer. In asthma, the airflow obstruction is usually variable and reversible. That means if you take medication called a bronchodilator, which opens the airways, your FEV1 and the ratio often improve significantly. A common sign of asthma is an increase in FEV1 of more than 12% and 200 milliliters after using a bronchodilator. This change shows the airway narrowing can be reversed, at least temporarily. COPD, on the other hand, tends to cause a more fixed airway obstruction. Even after using a bronchodilator, the FEV1 FVC ratio stays below the normal threshold of 0.70 or the lower limit of normal. The improvement in FEV1 is usually minimal or absent, indicating that the airflow limitation is less reversible. This pattern helps distinguish COPD from asthma. Doctors use spirometry testing before and after administering a bronchodilator to gather more clues. If the ratio improves a lot after medication, asthma is more likely. If it stays low, COPD is suspected. But it's important to remember that the FEV1 FVC ratio alone cannot tell the full story. The patient's medical history, age, smoking habits, and symptom patterns all play vital roles in making an accurate diagnosis. In summary, the FEV1 to FVC ratio is an important starting point for identifying airflow issues. However, it's not the only piece of the puzzle. The key to telling asthma from COPD lies in how much the airflow improves after bronchodilator use. This response helps doctors see if the airway narrowing can be reversed, which is a hallmark of asthma. So, while the ratio is a helpful tool, it works best when combined with other tests and clinical information to give a clear picture of what's causing breathing trouble.